Hello, and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. The Hope Center for Youth and Family Crisis in Fuquay-Varina, North Carolina, is a joint venture between KidsPeace and Alliance Health of North Carolina, and it just reached an important milestone. It's been 1 year since the center opened its behavioral health urgent care function. To talk about what the last year has taught us, as well as taking a look at the innovative mix of programs at the Hope Center, we sat down with Tammy Margeson and Michele Chassner. Here's our conversation. We are joined by Tammy Margeson, Executive Director of the Hope Center for Youth and Family Crisis in Fuquay-Varina, North Carolina, and Michele Chassner, the Regional Customer Relations Liaison for North Carolina. Welcome to you both. Thanks for joining us.
Thank you for having us.
All right. This month, June 2024, marks the 1-year anniversary of the opening of the Behavioral Health Urgent Care function, which we call the BHUC, at the Hope Center. And to start off, Tammy, I was wondering if you could briefly sketch out what a visit to the Hope Center might entail for a family who is coming with a child or family member who is in crisis. What would they expect to have happen?
Oh, absolutely. Well, the fun part about crisis services is every visit's different. But I often tell my staff that family and the youth, they define what a crisis is for them. And they are welcome to walk in for a brief crisis assessment 24 hours a day, 7 days a week. When they walk through the front door, they're greeted by our admission specialists at the front desk. They, of course, do all of the fun things like fill out paperwork and ask them why they're there and all of those wonderful things. And then as quickly as possible, once they're in our system, they go back and they meet with our clinicians for a complete crisis assessment, and that includes the parents and the child. Sometimes the parents talk alone or the child talks alone with the clinician. It's every family has different needs, and we try and meet those. And then based on the level of need, it could be a brief crisis assessment, and we do a crisis plan with the family and connect them with some community supports that they may need and send them on their way, and everybody goes home. Or if necessary, then a child may be asked to stay for 23 hours of observation just to ensure that they're safe and that we can meet their level of care needs.
So safety, obviously, a very important part of this whole process. I'm wondering, now that you have a sort of a year under the belt here, what in your mind in general has been the impact the service has had for clients and their families who have come in the midst of a crisis?
Well, I mean, we have all kinds of wonderful, warm and fuzzy stories, from the plushies that walk out the door because they've formed an attachment to a child and I can't leave a sad plushie on the unit, all the way up to the number of kids that we've served. So since June 5th of last year, 761 children and teenagers have not gone to the emergency room in a mental health crisis in our area. And 405 of those have been just since January of this year.
Wow.
Yeah.
That's, pretty close to 3 or 4 a day. Yep. I don't know how many folks in the community or really any community realize just how needed that is. And that kind of leads me to my question for you, Michele. Sort of the same concept. What do you find in talking to the groups in the region there has been the impact of having the service available in their community?
Yeah, I have received such positive feedback from the community. They have been such incredible support from the various organizations and parents to have the center in their community. When the parents are overwhelmed when their children are struggling with behavioral health concerns, and really don't know what to do. So to have this alternative to a hospital emergency department is tremendous, and it reflects by the reactions I get when speaking to the community in regards to the services offered. And I want to say that, you know, in the beginning, you would speak to different organizations, parents and such, but more and more I'm getting phone calls from students at school who hear about the services. And I think that's when you know that you're actually doing something right, when the mental health stigma is being ignored and the children are actually reaching out and being strong. So
It's one of those things that, as you both know very well, we deal with in this field all the time, and anything that indicates the stigma is breaking down is a positive.
mhm.
In addition to the 1-year anniversary of the BHUC, we've also just passed the 2-year anniversary of the mobile crisis response service, which is called MORS. Tammy, how is that service doing? How has it grown and evolved since we started it up back in 2022?
Well, when we started in 2022, all of my decades of experience with crisis services couldn't have prepared me for mobile crisis. It's not something that I had experience with. So we learned together how that worked. And it's different than a mobile crisis per se that people here in North Carolina are used to. It's called MORS, which stands for Mobile Outreach Response Engagement and Stabilization Services. And the goal is to keep the family together, to keep the child in the home. When we first started, we ran approximately 12 hours a day for about the first year, maybe 14 months of that. And then, excuse me. And then in late 2023, we stepped it up to 24 hours a day. And since we started 2 years ago, we've served just under 300 families with our MORS team. Now, mind you, that is a service that is focused primarily on Alliance members. So those children and youth who are on Alliance Tailored Plan Medicaid, which really kind of minimizes the number of people served, will go out in a crisis to anybody who calls. But the extended 8-week service that MORS offers is for Alliance members here in the 5-county region that we service.
Another example of trying to be more innovative in the way of delivering these services and this help. And speaking of that, there's a third element to the center. This is a facility-based crisis program where children can be cared for in a staff-secure environment. My understanding is that is close to launching soon, correct?
Yes, and I get questions daily from our funder and from our community. We just passed our licensing review, both our construction and file review. We're waiting on the finalization of the paperwork. Once we receive that, then we will be authorized to open at a lower capacity initially. We're going to open a 6-bed unit for ages 13 to 17 initially. While we continue to address milieu and physical plant things that need to be addressed to open the larger unit and assure that we're fully staffed for it. But we are, instead of months away, we are days and weeks away from opening our doors for extended stay.
It's a very complex situation. It's not something you just say, today I decided to do it, so tomorrow I'm paying out the shingle, obviously.
Yeah.
You mentioned the funder, Alliance Health. How important do you feel the partnership has been in terms of the Hope Centers being able to provide these services and seeing them grow, of having Alliance as that partner?
Tremendous.
Yeah, honestly, I think that's one of the most important aspects of this entire project. I have worked with multiple different funding agencies here in North Carolina in the last couple of decades. And Alliance by far is the most involved, the most supportive. they make it possible for providers to assist the community by standing up services, and they do that by financially supporting that provider while they ramp up for full service.
Yeah. And again, Michele, you mentioned how important it is. As we look ahead, are there other areas of North Carolina or other areas of the country who are maybe looking at the Hope Center model as something they might want to duplicate in their communities?
Absolutely. When I speak to anyone outside of our catchment area, the common theme is how can we replicate? So we are very grateful to be partnered with Alliance. And, if really the overall consensus is if we can replicate, and everyone would like to see it scattered around enough that it's going to be easily accessible for every youth and adolescent and adult to obtain the services that they need. So if we can replicate as much as we can to have this service available and attainable to everybody, then it can only benefit the counties and the communities.
And
Even
and
at
you
crisis
folks-
time.
and that's right. And you folks and your staff are, kind of running that initial thing. You guys are the first people on the moon, so to speak. And
Yes.
what are we learning? What they're learning from us and from your experience is just going to make it easier down the way for this model to take root. To wrap up our conversation today, we normally try to get a story that might be very inspirational or something that gives people something to go away. And Michele, you shared with me a very unexpected and meaningful request that you received, and I wonder if you could bring us to a close by telling us that story.
Sure. With Mental Health Awareness Month just coming to an end, at the end of the month, it was a young child's birthday. She was turning 12, and she had received services through the Hope Center. And for her birthday, she was having a birthday party at the church and wanted her theme to be mental health awareness. So her mom had reached out asking if I could come and talk about mental health, our services, and just give the community hopefulness, because there are so many children in crisis, and the girl really wanted to spread that spirit around, knowing that how resilient and how strong she was. So her birthday was themed mental health awareness, and it was beautiful. It was really heartwarming. So it was a great experience. Not typical, but I'm glad that I was honored to be a part of it.
Well, again, one of those things that talks to the end, perhaps, coming about the stigma about mental health care, which we'd all like to see. First of all, congratulations again to you and the staff there, tremendously dedicated folks. I've had the opportunity to talk with them. I was able to be there a year ago for the opening ceremony. It's just really inspiring to so many of us that we're providing these services, and we're providing it in a way that might end up becoming something that could be replicated and could make sure that more people get this kind of help.
Yes.
I know it can be replicated.
Yes, absolutely. And it needs to be.
Well, we will, and when we do that, I would love to have the both of you come back, and we'll talk about how we continue to lead the way. In the meantime, congratulations on the anniversary, and thank you and your staff for everything you do.
Thank you so much, Bob.
All right. Tammy Margeson is Executive Director of the Hope Center for Youth and Family Crisis in Fuquay-Varina, North Carolina. Michele Chassner is the Regional Customer Relations Liaison in North Carolina. And thank you both for joining us. Appreciate it. And we thank you all for joining us as well. We hope that you'll join us again for more conversations with KidsPeace. Until then, take care.